Hello and welcome. Today we're diving into the world of nephrology to discuss a fascinating, yet potentially serious, condition called renal papillary necrosis, or RPN. Join us as we explore its causes, how it affects the kidneys, and what can be done about it. So, what causes renal papillary necrosis? Several factors can contribute to its development. The most common culprits are analgesic abuse, specifically long-term use of pain medications like NSAIDs, diabetes mellitus, where persistently high blood sugar levels damage the delicate kidney tissues, sickle cell disease or trait, due to the abnormal shape of red blood cells obstructing blood flow, and urinary tract obstruction, which increases pressure within the kidney. Less common causes include severe pyelonephritis, a kidney infection, renal vein thrombosis, and rarely dehydration or certain medications. To understand RPN, we need to look at what happens inside the kidney. The renal papillae are the tips of the renal pyramids, structures within the kidney that collect urine. In RPN, these papillae undergo ischemic necrosis, meaning they die due to a lack of blood supply. This usually begins at the tip of the papilla and extends upward. This necrosis is triggered by the underlying cause, such as vasoconstriction from analgesics or blockage from sickled cells. The dead tissue can then slough off, detaching from the kidney and passing down the urinary tract, potentially causing further complications. Renal papillary necrosis is a relatively uncommon condition, but its prevalence varies depending on the population studied and the availability of data. It's more frequently seen in individuals with diabetes, particularly those with poorly controlled blood sugar, and in those with chronic pain conditions who heavily rely on pain relievers. It is also more common in individuals with sickle cell disease or trait. Precise epidemiological data is challenging to gather due to variations in diagnostic practices and the often insidious onset of the disease. The signs and symptoms of RPN can vary greatly from person to person. Some individuals might be completely asymptomatic, especially in the early stages. However, as the condition progresses, symptoms may include flank pain, which is pain in the side and back, hematuria, or blood in the urine, pyuria, which is pus in the urine, indicating infection, fever and chills, particularly if an infection is present, and symptoms related to kidney dysfunction, such as increased urination, especially at night, or decreased urine output. In severe cases, RPN can lead to kidney failure. Diagnosing renal papillary necrosis usually involves a combination of clinical evaluation and imaging studies. A urine analysis can reveal blood, pus, and sometimes even fragments of necrotic papillary tissue. An intravenous pyelogram, or IVP, used to be a common diagnostic tool. It involves injecting a contrast dye and taking X-rays to visualize the urinary tract. However, CT scans with contrast are now more commonly used, offering a more detailed view of the kidneys and urinary system, and showing the characteristic ring shadow, or medullary cavitation appearance of the affected papilla. Ultrasound may also be used, but it is less sensitive than CT or IVP. While there aren't formally defined types of RPN, it is useful to classify it based on the underlying cause. We can differentiate between analgesic-induced RPN, diabetic RPN, sickle cell-related RPN, and RPN caused by urinary obstruction or infection. This classification helps guide treatment strategies and address the specific contributing factors. The treatment and management of renal papillary necrosis depend largely on the underlying cause and the severity of the condition. The primary goal is to address the underlying cause, for example, controlling blood sugar in diabetics, discontinuing or reducing analgesic use, treating infections, or relieving urinary obstruction. Supportive care includes pain management, ensuring adequate hydration, and monitoring kidney function. In some cases, surgery may be necessary to remove obstructing tissue or repair structural abnormalities. If kidney function is severely compromised, dialysis or even kidney transplantation might be required. Preventing renal papillary necrosis involves minimizing risk factors. This includes avoiding chronic overuse of pain medications, particularly NSAIDs, carefully managing diabetes through diet, exercise, and medication, and ensuring prompt treatment of urinary tract infections. Genetic counseling may be beneficial for individuals with sickle cell trait who are considering starting a family. Regular check-ups with a healthcare provider are crucial, especially for individuals with predisposing conditions. The prognosis for renal papillary necrosis varies. In some cases, if the underlying cause is addressed early and kidney damage is minimal, kidney function can be preserved. However, if the condition is left untreated or is severe, it can lead to chronic kidney disease and ultimately, kidney failure requiring dialysis or transplantation. Recent research focuses on identifying biomarkers for early detection and developing targeted therapies to protect the kidneys from further damage. Researchers are also exploring novel approaches to prevent and manage the underlying conditions that contribute to RPN. Thank you for joining us on this journey into renal papillary necrosis. Remember, early detection and management are key to a better outcome.